Steve, thank you for that. It is so striking to see you back in front of that sign. I just remember watching all of those live shots. You were there. Our colleagues were there from that exact same location a year ago. Dasha, same with you in Tennessee. You know, the place you're in went from at one point seeing 1 in 4 tests positive, right, at the height of this crisis, to now leading the state in vaccinations. How did they do it? What do they feel like their takeaways are?
Hey, Hallie. Yeah, we've been reporting on this region for months now, and the last time we were here in December was one of the darkest times for this community. We saw firsthand what happens behind those hospital doors when we spent time with nurses in the ICUs, saw the heartbreak that was permeating those hallways as they were seeing patients die on every single shift. And Hallie, we also saw the mobile morgue trailer that was parked here when the hospital's morgue ran out of space. We actually reported on it on your show because at the time there were conspiracy theories circulating in this community that the trailer was not real, that COVID was a hoax. Well, since then, things have begun to turn around, and I want you to hear from Alison Johnson. She's a nurse of 17 years, and she's also a member of this community. And when we last met her in December, she told me about going to the grocery store and seeing her neighbors without masks and worrying that she would wind up seeing them in her ICU. Well, now she says the picture looks a bit different. Take a listen.
People that I knew personally that didn't think it was that big of a deal, who then either came to be a patient on one of our units or had family members that did. I think it changed their perspective. When it affects you personally, for some people, that's when it really, has the impact.
And Hallie, unfortunately, so many people here have seen that impact, but I am happy to report that right now here at Johnson City Medical Center, there is not a single COVID patient on a ventilator, a far cry from what we saw when we were here last. And it's been a combination of factors, innovative treatments like monoclonal antibodies, the hospital system's Safer at Home program where they're helping patients recover at home. But in talking to folks here, I get the sense that it's really coming down to the stories, especially the stories of these frontline workers whose resilience has helped this community turn the corner from suffering to hope. Hallie.
Dasha Burns, live for us there in Johnson City. Dasha, thank you. Sarah, tell us more about that third wave warning, if you will, where you are in Germany, even as Europe is working to, really ramp up its own vaccine rollout.